Hello, and welcome to this provider demonstration of DirectCareCareers.com. Today, we're going to walk through provider verification and help you get familiar with the main features of the website. To get started, you will need to go to DirectCareCareers.com. You can see that landing page on my screen right now. It says demo at the beginning of that. You would just go to DirectCareCareers.com because we're going to be exploring the site in our demo environment. So when you log in, just ignore that and go straight to DirectCareCareers.com. So this screen is what you will see when you first arrive. And at the top right, you'll notice that there are three icons. So we kind of have this question mark, a login, and this menu. In the menu, you have a link to contact us. So this will bring up the email of the help desk. And if you're having any troubles registering or logging in, you can go to that and ask for help there. Or you can go to the help documents page, which is also this question mark here. So this would be your first stop if you encounter any issues. And this brings up help documents. This says Pennsylvania. Don't worry about that. Again, this is our demo environment. But once you're on the actual live environment, this will all be Colorado help material. So once you have figured out if you can log in, what you want to do that now is go to Colorado. So once you click on Colorado, you're going to have a series of drop downs. So you'll have sign up as an employer/provider, which for our purposes today is what we need to go into. We also have areas where people can sign up as a CDOS employer and a separate one drop down for direct care workers or potential direct care workers to sign up. So I want to go ahead and click on that drop down. And the first part of this is just basically if you try your provider name, your tax ID number, and your zip code, and you can't get in, what you would want to do first is go to Health First Colorado and confirm that the information that you're putting into the provider's name or your zip code is what we have on that website. So you'd look yourself up on healthfirstcolorado.com and put it in as your name and your zip code and as you see it there. Oftentimes we find what trips people up here is a comma, something that's capitalized on one in our system that's not capitalized in yours. There's a period. So all of those things can contribute because this is case sensitive as well. So once you put in your provider name, your ID, your provider email, and you can use any email, that is not part of the verification process, but your provider name, tax ID, and the zip code are. So those all have to match what we have on our system. But you can use your HR's email, your email, whatever you would like at this point. So what you can do is just put that in. Once you get into the system, you'll get to a page and you'll create a password to get in here. But I already have a dummy account already pulled up. So after you register, this is where you'll go to log in, and then you'll hit continue. And once you come in here, you'll see the dashboard, your workspace. And this has all of the links that you as a provider will need to kind of navigate yourself through the site. So we'll start on the My Workspace page here, which is also account details. And we have your name. We also have this little filler image. So when you're first signing up and you're putting your information in, there's a section where you can go in and upload your logo, your photo. So if you want to put that in there, you're more than welcome to. So once you've done all that, you'll come to this page and it'll show you your information, your employer's name, your zip code, and your email address that you're using. If you scroll down a little bit, you'll come to manage employer profiles. And so this is your employer profile down here. So if you click on your name, it will bring you to a section where you can edit your information and change that around and put in more information about you. So this is a really great place if you want to put in information about your agency, your and who you are. So that way, if direct care workers are sort of exploring the site and they see your information, they'll know a little bit more about you. You also have a section to change the employer type. So if you are an individual employer, you're at your only location, you do not have to come to this and change anything here. But if you are a corporate provider with multiple locations, you'll want to come in here and change that, and then with multiple locations. What this does is, so let's say that you are in your office in, say, Denver, and you have a location in Colorado Springs. So the person who created this site in Denver, the person who created this profile for your organization can come in here, click on corporate with multiple locations and click update. And then what it's going to do is prompt you to add account managers. So what you can do at that point is add your account manager, your HR specialist, or whoever you would like to have access to this site in your Colorado Springs office, and put their name and their email in there, and it will send them an invitation to join this profile. That way, you have, with all of your different offices, all of your information for direct care careers is going to be on the same profile, and you don't have to create multiple different profiles for your organization in the different cities that you are. So everyone can use this and collaborate within this website, rather than having individual offices throughout here. So we're going to go back to my workspace real quick, and we'll scroll down, and we have this nifty banner here. We did change our learning management system a few months ago. So what we wanted to do was be able to do more things with the learning management system, be able to offer badges and things like that. And we wanted to get a little bit deeper into our reporting needs. And also, this just looks way better than what we were able to do with our other learning management system. So we'll go into that here in a little bit and look around. And we also have our bookmarks. So if you're in here and you find a direct care worker, you can bookmark them, and I'll show you how to do that a little bit later. And also with resources, you can bookmark those, but this is where they are once you've bookmarked the resources or jobs or direct care workers that you're interested in. So next, we've already looked at account details and editing your account. We have job posts, which we'll get to in a little bit, and my message and notifications. So all of that is creating information and job posts. So what we want to do before we get to those, we want to go to add a job post. So what this will do is it will take you to how to create a job post. And I got a little bit ahead of myself. You'll notice that there are two options under the quick links. You can add a job post or add a job post template. So if you're an employer who has or thinks they're going to have to post for a direct care worker position throughout the year multiple times, you can create a job post template. And then that way, once you go through and you fill out all the fields, you can name that template and then come back to it later if you ever have to repost for the same or similar job. And that just saves you time instead of going through and checking all the boxes of what experience people need, what benefits you offer, and things like that. That's just a little bit of a time saver there. So we're just going to go into add a job post. So what you would want to do here is add the job title. I'm not going to go through and fill this in because I already have a job post up, but I just want to kind of walk you through everything that you're going to look for. You can, or experience when you're creating a job post, you can put the number of positions available, the city work location, because we know that, lots of organizations have people in different zip codes, different areas, and are reaching out to those folks in those areas. So what will happen is that we have a job matching tool And the first thing it looks at is zip code, because you don't want to post something on here and get candidates from all across the state. So if you were in Denver, you don't want to get someone from Durango or somewhere on the western slope or something, or on the eastern plains or anything like that. So you can put in the work city, and you'll the first people you see with that job matching tool will be the closest people to that zip code and in that city. And then we have other parameters that I'll go into a little bit later, but everything on this job posting kind of factors into that job matching, because on the other side, and we have a video if you want to see, kind of what a worker sees and how they sign up. We have a demo video for those folks as well, where you found this video. And you can go in and see the similarities, because we're really trying to match the job posting to the resume that you fill out to that of the direct care worker. So you put in that zip code, and then if you were creating a post from an existing template, this is where you would come and get those. We have one in here as an independent contractor, just as an example. And then we have type of services needed. So you can come in here and kind of click on everything that this individual or this job is going to require, and just click on all of those. Pretty simple as you're walking or as you're going through this. And if you get through it and there are specific services that are needed for this individual that were not in that list, you can come here to this text box, type those in, and it will show up on the job posting as well. All right, so under this, we have minimal qualifications or requirements. So if you kind of want, if you're willing to start with a clean slate with someone who's really never been a direct care worker, and you're able to give them that training, you don't have to hit any of these or check any of these boxes. But if you have specific requirements for folks, come in here and you can say that they need at least a high school diploma and require a driver's license or things like that. Back that other way. And then again, if there was something in the minimum qualifications that wasn't listed in our easy sort of check boxes that your organization requires, you can put them in right here with this text box. The next is credentials. So if there are any credentials that you require, or this position that your posting requires, you can check these off. And then we have what candidates, candidates who can provide support for adults or children or all of the above. You can check off all of those if you need someone to fill all of those positions. We also have the section for individuals who can provide support to other individuals with the following needs. So if someone has medical needs or mental health or emotional needs that you're going to be posting this job for, you can click those off. And again, if there's a need that is not listed here, you can type it in this text box and it will show up on the job posting as well. We have a section of what the environment is going to be like. This is just so, individuals, if they're looking for a job, but they're allergic to animals, obviously probably not an ideal position for them if they're not able to enter a home with animal dander. Or we also have if there's a specific language needed. So you can put on if they need to speak English and Spanish, if you have Spanish speakers who are going to be receiving this, or that's their preferred language, you can throw that on there as well. And again, if there's any languages here that that are spoken that we haven't listed, you can go ahead and add them. They'll be added to the job description. If there's gender preferences, you can click gender preferences, and then we also have availability. So if you're looking for someone full-time or part-time, you can click on those. We'll say full-time, and then the start date. So if we were saying, well, this really doesn't start until March, we can put that the first Monday of March. And if you have an end date, you can put that in. If you don't have an end date, you don't have to put that in. It's not going to show up on the job posting. You can also put service days on here. So if it's just a normal work week, you can put that on there to let people know. But if it's not, and it's say like every other day and Saturdays, you can change it up and put it specifically for what this job needs. And that goes for shifts as well. So if it's a day shift, an evening, or overnight, you can click on that. We also have the benefits in here for an easy clickable form. So if you offer health insurance and paid overtime and paid vacation and a 401k, you can come in here and click. If you offer everything, you can just click that handy select all checkbox up there. And then this is your provider name. It autofills. So we made up Active Belief as our provider name here. We also have the minimum hourly rate. So there is the direct care minimum wage. So if you put anything in here under that direct care minimum wage, so I'll say that we're going to say $15 an hour, you can come in here and hit save. And this is what you'll see. You'll have an edit coming up saying the hourly rate cannot be under $17 an hour. So we'll go ahead and put 17 on there so we can get through. If you have a maximum hourly rate, you can put it in there. If you don't want it to be shown, you don't have to put that on there either. But it's always good to give people like a range of what they could make in this role as well with your organization. Lastly, we have check this box to make this job post available. So say you started your job post, you want to save it, but it's not completed yet. You can come down here and hit save and not check that box. And once you're able to complete it, you can come back in here, check, I want this to make this job post available, and then click save. We're not going to do that right now. We're just going to hit cancel and go back to my workspace. And then we're going to look at a job post that I have created. So I'm going to go over here to my job posts. And this will bring up a direct care worker job posting that I went through and created. So if you come in here and you go to view details, it'll bring up all of the details that we put into this job posting, as well as all of the individuals who are auto matched with this job posting. So, and it's as quick as you filling one of these job posting out. So once you get to this point, you've posted it online, you already have potential direct care workers waiting in your queue at the bottom. So we're just going to go through this. So right here, we're in view mode. If you want to edit it, you can come in here and edit the job posting from here. If there's new information that comes up, you can change that. We also have this bookmark, so you can bookmark your own posting. We also have, and get quick access to it, you can print it. If you're a paper person and you want some stuff in paper, you can come in here and print that as well. We also have renew job post and close job post. So if you're finished with this job post, it's been filled, or you don't need it to advertise it anymore, you can come to close it. It's as easy as coming in here and clicking this, or if you need to renew it. So job posts, once they're up, are only up for 90 days. And that's to really keep job posts fresh and make sure that all the job posts on there are still actively looking for workers. You will get notifications leading up to that 90 days, at 60 days, and I think 75 days, saying, hey, if you haven't filled this, come back here and renew your job post. So that's there's a link to it in those emails that will bring you back to your profile. And to renew it, it's as easy as clicking renew job post, and that will renew it for another 90 days. If you get to the point where you, for some reason, can't respond to those emails saying, it's going to pause your job posting, and it goes away after 90 days, the job posting doesn't go away. It just is basically unpublished. And so you can come in here, come to the job posting and republish it. Just again, as easy as renewing a job post with a click of the button. So these are all the qualifications, credentials, the benefits, everything that we just kind of went through with this pay scale here. And then when you come down here, you can choose between screen candidates and top matches for candidates. So top matches for candidates, that's going to be everyone who is within that zip code, who has the qualifications similar to what we filled out in this job posting. Right now, we're just going to look at screen candidates, and we have one person here. And so this little card just gives you like a really quick overview of the person. So if you wanted to look further at them, you can come here and go to their profile. You can download the resume from this icon, and then you can initiate contact with them through the website by clicking the envelope here. And you can add in people or remove them by this icon. But this gives you a really good idea of like what their role is currently, what their experience is, their availability, and where they are. If you go to the very bottom here, we have auto match criteria. And so this really tells you how they matched with the job posting. So the first one is location proximity, so off that zip code. And then the second is their availability. So their availability full-time, Monday through Friday, matched with our job posting. And then you can see on this one, there's a little number with types of service. So they matched with 3 types of our service, and they match by gender as well. So that gives you a really quick idea of who this person is and what they're all about. You can also come down here and select status. So we encourage you to use this tool. Not only does it keep you organized and you know who you've reached out to, who you haven't, who have you extended an offer to, who you haven't. It really helps us as well to know that you guys are using the site. How are you using it? If you're, hiring people from the site. So we really encourage you to come in and complete the flow of work as you're hiring folks to give us an idea how our site's working, if it's working, and also to keep you organized as you're, going through candidates on the site. So we haven't done anything with this person yet, but I'm going to reach out to them. So I'm going to switch that to waiting for a response. And then I'm going to click on the envelope here. And well, it updated my status. So we're going to come back down here and say envelope. And this is going to take us to create a message. And all of the messages within the Direct Care Careers are templates. So what you'd want to come down here to select a message. And the only one at this point is to invite for an interview. And once you select invite for an interview, you can come in here and change the date or select dates that you would be available with the times that you would be available. So we give you 3 options so that once you send it to the person, if any of those 3 options works for them, they can say, hey, yes, and select one and tell you, and then you can set up the interview from there. If none of them work for that individual, they have the option of selecting another 3 dates and connecting with you to get an interview time down. So we do have another option. It's just not on the demo right now of sending a template for a phone interview, like a pre-interview. So that's on there right now as well. So if you come down to preview, it'll show you the message. Basically, we came across your resume, interested in discussing this role with you. And then, of course, the times available down at the bottom. So that's what it looks like when the direct care worker receives your message. So we'll come back out here real quick and scroll down just a bit, back down to, here we go. And so once you've created the message and you've reached out to this individual, again, you can go down to that card, and that's what I was doing. Sorry, I didn't mean to. And then you can make sure it's waiting for a response. Or if they said, hey, yes, I've come back, you interview them, they had a time that was good, and you're able to meet with them, you can say interviewed candidate. And so then you know who you've interviewed, and ultimately come in here and update it to hopefully that you have extended an offer and hired this individual is the ultimate goal here. And then from there, you can come over here and close the job post. For now, we are going to go back to my workspace, and there's a My Message tab. So if you come in here, this is where all of your messages from all of your outreaches, or if you're communicating with any direct care workers. About job postings, I would like to reiterate that it's very important not to wait for direct care workers to reach out to you. They may not, but if you're looking for someone and you go through all of your matched candidates from the matching algorithm and you find people who you're interested in, definitely reach out to them and sort of solicit them to your job, because it's sort of the same on the other side of this website for workers. So they can sign up for it and not be actively looking for a job. It was sort of like that little checkbox at the bottom of the job posting where you said, yes, I want this to be viewable for workers, right? So workers have that exact same checkbox on their side where it's like, I want to make my profile viewable for employers. So if someone's not looking for a job, they can unclick that, they won't appear for you. So anyone who's up there who you've matched with are actively looking for work. So it behooves you to go ahead and try to contact them, as well as waiting instead of waiting for folks to reach out to you. Lastly, we have notification preferences. So what we have here, you'll get emails from the website periodically. And this is just how often you want to receive those notifications. I just leave everything as a weekly digest. I get one email per week, but if you want more communication from us, you can put that as daily, or if you want it as soon as it happens, you can do it immediately. But also, if you don't want any, you don't have to receive it. I will say we're adding trainings to the site. We add resources every week. So there's things that come up that might be beneficial to you to know about. So I would at least keep these on weekly digest rather than none. But you can come in here and save those preferences so you don't get too many emails from us, or too few. Next, we have jobs. If you click on jobs, it'll come up with all the jobs that are currently available on the site. And then we have resources. So like I said, I update the resources every week. I usually put on about 4 new resources. So if we come in here and we want to find resources on insurance, we can go ahead and just type that in. Use a single keyword. Don't use phrases. It doesn't really like phrases. It won't come up with exactly what you were looking for. It'll kind of have like a little bit of a muddled return. But if you use single words that are the kind of the topic of what you're looking for, that'll bring it up. We also have, you can look up by type. So if you're looking for a video or a document, you can select those. We have topics, so mental health, housing, and financial. These are just really ways to filter down any of the results, and then what audience you're looking for as well. So we're just going to say insurance and see what comes up here. So once that happens, it'll come up with anything that has to do with insurance. So about the Affordable Care Act, it looks like we have quite a few people who have bookmarked this. So you can come in here, bookmark it, and now that's going to be on your main page so you can find it easily. There's resources on explaining the explanation of benefits, which can be very confusing, Medicare basics. So anything you want. And you have resources on here for helping prevent burnout, and just really things like working with nonprofits in the community, applying for grants. So if you're looking for any resources like that as an employer, we really do scour the internet and use our partners for really great resources that we put on here. The Collaborate feature So this is a little bit under construction right now. What we're aiming for is to have this where people can come in, make a posting, just sort of asking if they're kind of at their wits' end, they need a resource in their community, say they're in a rural neighborhood, and they can't find anyone that can help, or they're looking for a specific durable medical equipment. They could come here and say like, hey, does anyone in this area know? And hopefully it'll just be like a little community where people can, help spread information or give information. Then we have the contact us, and this is really just a template to send an email to our help desk. And then of course we have help, which is all of our user guides that we kind of went through when we were about to sign up. I'm going to go back to my workspace real quick and just show you a couple more features on the site. So we have a drop down here to translate the site. So if you come down on our main site, it's not Portuguese, it's Spanish. I'm not sure why they did that for the demo, but that's where we are. But it'll translate the whole site. We're going to go revert this back to English. We also have a chat with us. So it's the same sort of thing. It's a little bit quicker, where you can kind of like text with someone if you're having issues or anything like that. You can chat with someone online with any of your questions. A note on the translate feature. It does work with the LMS, but not in the way that we want it to. So this is something, again, we are working on fixing, is when you enter a module, you can go up and you can switch it to the preferred language that you would like to view the module in, and it will translate. However, when you move on to the next page of the module, it reverts back to English. And unfortunately, you have to come in, click on English again, and then go back and click on Spanish again. It's not preferable. So we are working on getting that fixed, but you can, at this time, you can still view things in your preferred language if it's in that translate. So lastly, we're going to come into our learning center. So this is our learning management system, where you can come in and view trainings. And if you want to sort of, if you have trainings in here that you like, that you think it would be beneficial for your employees that you have currently, you can get them signed up on the website, and they can take any and all of these trainings. They're all free. I forgot to mention with resources, all the resources we find are free as well. Nothing that you ever need to pay for. So we just went into where we house all of our modules, and you can come down here. We'll go to newest. This is just a way to filter and find stuff. Oh, excuse me, I'll go to oldest is what I meant. And so we have everything starting from who are direct care workers and observing, reporting, and documenting. So it's really like, if you're totally new to direct care work, you don't really know what it is even, these modules will give you a really good idea of what it is, and it kind of moves and becomes, you get more and more information from there. But we have cleaning procedures, communication, we have HIPAA, we have ethics and legal issues, and basic first aid, and all of these were created from a universal worker perspective. So no matter what type of direct care worker you are, these are the basics. So they call it the Colorado Direct Care Training. So if you come in here to all categories, we have these filtered by care categories. We also have what we called career paths. So if you come in here, if there's a direct care worker and they kind of wanted to find out if there are other what careers being a direct care worker can lead to, we have a few modules that show what they can sort of lead to in the work that they're presently doing. I have a video demo on those as well. So if you wanted to watch those are in there too. And then we have foundational skills. And so these are sort of basically skills that are sort of outside the realm of direct care work, but are still useful for people to know and understand and take. So we have stuff from, collaborating as a team, applying support styles, even from like how to write a resume, how to interview, and things like that. So those are a little outside of direct care training, but still valuable for folks to take. So we'll go back to our dashboard, and then we have view my courses. So in here, I have the HIPAA member confidentiality that I've enrolled in, but I haven't taken yet. You can come in here and look at what you have in progress, what you have not completed and finished. So this will be in there, and what you have completed in the past. So that just basically is a way to keep you organized. And then we have a frequently asked questions page. If you have any issues, if you're wondering what course certificates are, or you need technical support, that's the place to go. And we also have this recent drop down, so you can see what you've been in recently. And then under your sort of profile name, this is where you can find certificates. So certificates are issued once someone has completely finished a training module. They have to complete the module and also score at least 80% on the final questions, the quiz at the end. So I believe all of our, definitely all of our Colorado trainings have the final quiz, and none of our career paths have those. So if you finish a career path, you'll get a certificate, but you have to pass with an 80% grade to get a certificate. And those are actually, once you've completed the certificate, they're housed here. If you go in there, I don't have one quite yet. As you saw, I haven't completed my first module, but that's where there will be if you ever lose them. They're also emailed to you as soon as the module is complete. So if you have a direct care worker that you're like, hey, I need to know that you've done your HIPAA training this year, you can ask them to email you those certificates, and then you have that documentation. But for the direct care workers, everything is housed in there, so they don't have to keep track of all the certificates themselves. And down here, we kind of have like a quick dashboard about the courses that folks are enrolled in, how many courses are complete. And lastly, we have a calendar, and I'm going to go back a couple of months just because that's where I have an example here. So this is a new feature to the website as well as our calendar. So what we do is we look for webinars that have to do with dementia training, care management, anything that has to do. And I also throw up stuff on here from HICPUF, their public meetings. And so this is just basically an example of that. Right now, I think in the month we're in, I have over 25 webinars that are coming up, from tax help to, like I said, dementia training. But if you click on the webinar, it comes up with the title, when and where, and there's a site event and a description, and then a link to register. So once you find one that you like, you can go and check that out. So it's really beneficial to come back in here and check what's coming up, because there definitely is something for everyone within those webinars that we're finding. So that's the last of that. To get out of this page, you'll want to come back here and just say click or back to DCC workspace, and that will take you all the way back. The training environment doesn't like that, so I'm going to back click real quick. But in the actual environment, it's no sweat. Thank you for watching this provider demonstration and exploring directcarecareers.com with me. We hope this training was helpful, and we look forward to seeing you on the site. Thank you.